So guys, next in this the discussion in neuro, we're going to start with the brainstem. Well, after spinal cord, as we know the tracks already ascending and descending tract, but we also need to trace their pathway in the brainstem also. Like ascending tracts, as we already said, they are forming some lemniscus in the brainstem, medial lemniscus and spinal lemniscus we have already seen. And in the brainstem, we'll be talking about two more lemniscus, that is a trigeminal as well as a lateral lemniscus, which are related to the trigeminal nerve pathway and the auditory pathway respectively. But how we're going to approach the brainstem is, first we will look at the morphology, the external features. We will start with the ventral aspect of the brainstem and we see how cranial nerves are coming out. We have already discussed cranial nerve, but we need to know how exactly they exit the brainstem and from what point they are coming out. Then we also need to see from the front of the brainstem only that there is a fossa in between the two peduncles called as the interpeduncular fossa. So what are the boundaries of the interpeduncular fossa, what is its importance, and the content as well. And we'll also appreciate some perforating substances in the interpeduncular fossa and in relation to the anterior interpeduncular fossa. So all these things need to be covered from the front of the brainstem. That will be the first thing. After that, we will turn the brainstem, and once you turn the brainstem, we expect to see cerebellum behind it. Behind the pons, there is cerebellum. So we're going to remove the cerebellum because that we'll discuss separately. And you remove the cerebellum means you will be exposing the fourth ventricle because there is a fourth ventricle between pons and cerebellum. So looking at the dorsal aspect of brainstem, after removal of cerebellum will expose the diamond shaped fourth ventricle. So we'll also be talking about the details of fourth ventricle. Then followed by, we'll talk about certain pathways in the brainstem and finally about the syndromes. So this is a topic in which again, whatever we discussed in the head and neck, the cranial nerve nuclei, the cranial nerve columns, the cranial nerves itself, and the tracts we discussed in spinal cord. So this topic is an amalgam of everything. So first we are looking at the ventral aspect of brainstem. Okay, let me draw it for you and then I'm going to show you some pictures from the atlas also. If let's say this here is the pons, here is the cerebral peduncle. The cerebral peduncle, the part of the midbrain only. If you remember, we said in the transverse section of the midbrain, you will be seeing a tectum, tegmentum, and the crus cerebri or cerebral peduncle, which is present anteriorly or ventrally. That's a ventral aspect. So these are the two cerebral peduncle. And inferior, let's say here we got the medulla oblongata. This is medulla oblongata, and let's presume this is a midline. So this roughly is the anterior aspect of the brainstem. That's how it's going to look like. That is a part of midbrain. This is a part of midbrain. And what part is that? That is cerebral peduncle. I'm writing CP here. That is cerebral peduncle. This is pons. Pons, the literal meaning of the word pons is bridge. It's basically bridge between the brainstem and the cerebellum. So if any tract has to go from brainstem to cerebellum or from cerebellum to brainstem, it may take a different peduncle, superior, middle, inferior peduncle, but ultimately they're all going from the level of the pons itself. And then finally we got this medulla oblongata below. Between the two cerebral peduncle, this fossa here is called as interpeduncular fossa. This is what we got to discuss, that is interpeduncular fossa, but we'll be discussing it separately. The fossa, this is the, I'm writing interpeduncular fossa, IPF, interpeduncular fossa. And in the ventral part of the medulla oblongata, close to the midline, you will see these elevations which are called as pyramids. Well, clearly we call them pyramids because of the pyramidal tract. As we know, pyramidal tract will keep running on the same side, and in the lower medulla oblongata, they decussate. So that's why you can see the pyramid present in the most of the part of the ventral aspect of medulla. And more lateral to the pyramid, you can see another very prominent elevation here called as olive. Let me label them. Just try to label them one side only, guys. This is olive. Olive is because of what? Olive is there's some nucleus which is present deep to it, and that is the inferior olivary nucleus. There's a huge nucleus present inside called as inferior olivary nucleus, and that is the one which is producing this bulge called as olive. And this, as we already said, this is pyramid. Pyramid is simply because of pyramidal tract. So ventral aspect of the midbrain showing you the cerebral peduncle, and the fossa in between is interpeduncular fossa. You can see the ventral aspect of pons here, and as I said, the pons acts like a bridge. So all the peduncles, whether it is midbrain peduncle or medullary peduncle, they all go toward the pons first, and then they enter into cerebellum. That's why the word bridge is given to it. And then we have medulla. From the ventral aspect of medulla, the two major elevation that you will appreciate. One is olive. Let me just highlight them so that we can see how cranial nerves are coming out. This is olive, and more close to the midline, that's pyramid. These are pyramids. You will keep calling them pyramids till the decussation takes place, because all 100% fibers are present in the ventral part. No decussation, that means 100% fiber are here only. In the lower medulla oblongata, we know that 85 to 90% fibers will decussate. So only 10% fiber will be left in the anterior part. So the pyramid will be gone. I mean, they will vanish. So you can only see pyramid till the lower medulla oblongata. The first thing, how cranial nerves they exit, how cranial nerves are coming out of the brainstem, guys. Third nerve, we already discussed that in the cranial nerves. Third nerve is the content of interpeduncular fossa, and that's why you will see third nerve emerging like this from the interpeduncular fossa and winding around the cerebral peduncle. That is third nerve. Fourth is the only cranial nerve coming from dorsal aspect of brainstem. So that's the only nerve you see coming from the dorsal aspect of brainstem, and that is also winding around the cerebral peduncle. So that again could be a question. What are the two nerves which winds around the cerebral peduncle? The third nerve from the interpeduncular fossa, and fourth nerve is the one coming from the dorsal aspect of brainstem. Yes, pons is having many nuclei inside. There's so many nuclei we have inside the pons: facial nucleus and motor trigeminal nucleus and salivatory, inferior salivatory. But when you look at the nerve coming out, now it's not necessary that exactly where the nucleus is present, the nerve also need to come out from there. Because one nerve can have multiple nuclei. That's why don't think that facial motor nucleus is in pons, so the facial nerve should come out from here only. No, not necessary. So when you see the ventral aspect of pons, there is only one nerve that you see coming out from here, and that too very much toward the lateral side from the pontocerebellar angle region, and that is the thickest cranial nerve, the trigeminal. The fifth nerve is the only nerve emerging from the ventral aspect of the pons. Despite of having many nuclei inside, only one nerve comes out from the ventral aspect of pons, and that too very much toward the lateral side. That is the fifth nerve. Pontomedullary junction. Now that's an important point from where multiple nerves are coming out. Very close to midline, you will see the sixth nerve. Then got seventh nerve and eighth nerve. We are just looking at the nerve of one side only, guys. This is sixth nerve. Here's the seventh, and there we got eight. 6, 7, and 8. So what do you see for the sixth, seventh, and eighth nerve? I can say they're all coming out from what junction? Pontomedullary junction. Now yes, we can say 6th, 7th, and 8th nerve are coming out from pontomedullary junction. But this question can be more precise, that where exactly from pontomedullary junction. If you see 6th nerve is emerging from the ponto-pyramidal junction. If you talk about which part of medulla, pyramidal part. And 7th nerve is coming from ponto-olivary junction. So make sure you also note that the 6th nerve and 7th nerve, the 6th nerve emerges from ponto-pyramidal junction, and 7th nerve from ponto-olivary. Ponto-olivary junction. So that is 6th, 7th, and 8th nerve from the pontomedullary junction. More precisely, 6th and 7th from ponto-pyramidal and ponto-olivary respectively. Lateral to olive, you can see the 9, 10, and 11th nerve. 9th nerve, this 10th and 11th nerve They're all emerging just lateral to olive. If you remember, the common thing between these three nerves was they were all coming from nucleus ambiguous, and nucleus ambiguous was present in the medulla oblongata. So 9th, 10th, 11th nerve, they emerge from the ventral aspect of the medulla, but remember, where lateral to olive. These nerves are present lateral to olive. And finally, the only nerve that you see emerging between the olive and pyramid is the 12th nerve. That's the only nerve which emerges between pyramid and olive. See, these information are so important that right now it looks like we just have to know that where the nerve is coming out from. But when you take a transverse section of the medulla or any part of the brainstem for that matter, if you have an idea about how cranial nerve is coming out, so that will also help you identify in the transverse section also. Like when you take a transverse section of medulla oblongata, it's very easy to identify the olive and pyramid. You can very easily identify this close to the midline is pyramid and more laterally we have olive. And then if they in the transverse section they have shown some fiber coming out from there, you can make out, okay, if a nerve is present lateral to olive in the transverse section, it has to be either 9th, 10th or 11th nerve, and the only nerve which will be running between pyramid and olive close to the midline is 12th nerve or hypoglossal nerve. If you notice one more thing from this arrangement here, LR plate and the basal plate we talked about, one is a sensory plate, one is a motor plate. Well, this may not indicate everything in that sequence, but most of the motor nerves, not all, most of the motor nerves are seen relatively close to midline only. If you see 3rd nerve, it's close to the midline. 6th nerve, 7th nerve, closer to the midline only. 12th nerve, closer to the midline. And that is why the 3rd nerve and 6th nerve and 7th nerve and hypoglossal nerve, they will be involved in the syndromes of the brainstem which are affecting close to the midline only, like Weber's syndrome or medial medullary syndrome. We will discuss that. So that just having an idea about from the morphology only that what nerve are present where. So 3rd and 4th winding around the peduncle. 5th is the only nerve from the ventral aspect of pons. 6th, 7th, 8th from pontomedullary junction. 9th and 11th lateral to olive, and 12th nerve is between pyramid and olive. Let me take your attention from this part to that interpeduncular fossa now. Let's focus only to the cranial part of this ventral aspect of brainstem. But before that, I can show you one picture in which you can appreciate how the nerves are coming out. Now that's an atlas image, and as you can see the brainstem over there, the one, look at those lines over there, that represents the cerebral peduncle. That's a peduncle part, so it's midbrain. This whole thing is pons, and here we got medulla oblongata. Can you appreciate in the medulla oblongata, these are the pyramids, and lateral to pyramid, those elevations are the olive. So the nerve that we already discussed in there, this is the 3rd nerve. Now look at this nerve, that is the 4th nerve, and the 2 nerve that you see on the sides of the peduncle. Then we got this huge 5th nerve coming from the ventral aspect of pons. Look at the entire pons, only one nerve is coming out. Although you see 2 roots of the 5th nerve. 5th nerve is predominantly sensory nerve. So we have a thicker sensory part, and then we have thinner motor part. That's a motor part only, which will contribute to mandibular nerve. But overall, it's a trigeminal nerve only coming out from the ventral aspect of pons. Pontomedullary junction, look at the nerves. The 6th nerve. Then we have, again, look at this, these two. There is 7th nerve and there is 8th nerve. Now, why you're seeing again 2 in 7? Because that's a mixed nerve again. Facial nerve is predominantly motor, and we have a sensory function also. So thicker part there will be the motor part and thinner part will be the sensory part. But that is facial nerve. 6th, 7th and 8th nerve. I repeat again what I said. For the trigeminal nerve, it is a predominantly sensory nerve. So thicker portion will be the sensory root and thinner one is motor. But facial nerve is predominantly a motor nerve. So thicker part is motor and thinner one is sensory. You can see 9th, 10th and 11th nerve coming out from the lateral to olive, and you can appreciate both the part of 11th nerve. You can see cranial accessory is coming out from the brainstem, and look at spinal accessories ascending upward all the way and then coming out along with the cranial accessory only. Remember we said spinal accessory will go through foramen magnum, reach the cranial cavity and then again comes out from jugular foramen. So you can see both cranial as well as spinal accessory. And this nerve here, which is between pyramid and olive, is the 12th nerve or hypoglossal nerve. That is hypoglossal nerve. Now please don't get confused with this nerve over there. Well, that's not a spinal nerve. That is not a cranial nerve. That is a spinal nerve. That's the first cervical nerve. The same sulcus which is present between the pyramid and olive If you extend that sulcus downward, it is going to the spinal cord also. So that is the first cervical nerve you're looking at, the C1 nerve. So exactly in the same sulcus where we have hypoglossal nerve in the brainstem, if you trace that sulcus downward to the spinal cord, then you will start looking at the motor branches of the spinal nerve, the C1, C2, C3, C4, so on. So as I said, right now, let's focus onto this fossa that is called as interpeduncular fossa, guys. This fossa here is the interpeduncular fossa which we got to discuss. When we complete this diagram, we will see that anteriorly in the interpeduncular fossa, we have optic chiasma, and on the sides, we have optic tract also. And that completes the boundary of interpeduncular fossa. So let me take you back. So we're going to draw only the cranial part of the brainstem now. I request you to start slightly below because we have to ascend upward in this diagram. So if this is the once again pons, and here are the peduncles. And let's complete this fossa here, the interpeduncular fossa, by drawing the optic pathway. So this is the optic tract and chiasm. That is the fossa in between the interpeduncular fossa. So if I have to mark the boundaries of this fossa, it starts with this optic chiasm which is present in the midline venturi, that is optic chiasma. Then we got this tract. And this is peduncle, the cerebral peduncle. I hope you know the other name of cerebral peduncle. It is also called as the crus cerebri. Crus cerebri, cerebral peduncle or crus cerebri. Peduncle or this crus means white matter only. It's a white matter tuft that you see, and we call it cerebral peduncle or crus cerebri. Why the word cerebral peduncle? We discussed that earlier also, because the descending tracts from cerebrum are situated inside only. Pyramidal tract, extrapyramidal tract, they are all present in this peduncle part, and then they go to the pons and medulla. So guys, obviously the fossa in between is interpeduncular fossa. So boundaries are quite visible from here, the optic chiasma, tract and the peduncle. What are the contents inside? The contents of interpeduncular fossa includes, we got infundibulum, the stalk of pituitary, infundibulum, and this infundibulum extending from the elevation called as tuber cinereum. So let's say the number 1 over there is a cut section of infundibulum coming from this tuber cinereum. That elevation is called as tuber cinereum. Then we have this component of limbic system present here called as mammillary bodies. Let me give it number 2. Number 3, we already discussed, that is a third nerve. We said oculomotor nerve is a content of interpeduncular fossa. So let's give it number 3. And number 4 is a perforation that you will see in the posterior part where some blood vessels will be seen going inside. We call it posterior perforating substance. That is number 4. That is number 4. So optic chiasma, optic tract and cerebral peduncle, these are boundaries of interpeduncular fossa. These are the boundaries of interpeduncular fossa. Whereas contents, I've marked the contents with numbers. Let's write about them. Contents are number 1. Number 1 is infundibulum, that is a stalk of pituitary, infundibulum, and tuber cinereum. Tuber cinereum. Number 2 is mammillary bodies. Mammillary bodies are the one where the fornix will end. something we'll discuss later on. The fornix, that white matter bundle which starts from hippocampus, will end in the mammillary bodies. Number 3 is for the third nerve, that is oculomotor nerve. And number 4, which you should know more about, that is posterior perforating substance. That is called as a posterior perforating substance. Now, when you say something as a posterior perforating substance, it's an indication that there must be some anterior perforating substance also. If this is posterior perforating, now where is anterior perforating? Anterior perforating substance is not present inside the interpeduncular fossa, it is outside. For that, I need to add something more to this diagram. Now guys, let's presume if this here is an olfactory bulb and this is olfactory tract, and what you will see, the olfactory tract will divide in a medial stria and a lateral stria like this. This is the olfactory bulb. We are just looking at one side only. This is olfactory bulb. This is obviously olfactory tract. And then you can see the two divisions of the olfactory tract, the medial and the lateral division, or stria you can say. And between these medial and lateral stria, or lateral to optic chiasma, this is the point where we have the anterior perforating substance. Here we have the anterior perforating substance. I am writing APS, anterior perforating substance. So location wise it is more anterior, so anterior perforating, this is posterior perforating. But the question is, what exactly are perforating substance? Well, it is an area, or it's a gray matter of the brainstem which is perforated by certain arteries. See, the blood vessels which are running on the surface of the brain or brainstem, they need to supply in the core also. But how will they reach the core? Once they pierce the parenchyma, the gray matter and the parenchyma of the brainstem and cerebrum. So you will see some branches of a major artery here piercing this region, so we call it posterior perforating, and some branches are perforating that, so anterior perforating. Now to tell you what exactly branches are those, let me show you one picture. Now this time I'm showing you a real-time section of the ventral aspect of the brainstem along with the blood vessels on it. Now you're looking at this picture where you can see interpeduncular fossa clearly, that whole thing is the interpeduncular fossa. You can appreciate the boundary, we got an optic chiasma there. This is optic tract. There will be cerebral peduncle which is hidden by these blood vessels and all. So these are the boundaries. Content wise, look at that where I'm pointing at. This is infundibulum and tuber cinereum. Look at this. This is infundibulum and tuber cinereum. You can see those two mammillary bodies. Third nerve. Can you see the third nerve over there? That's a third nerve coming out here. And when we discuss the third and the fourth nerve in the cranial nerves, we said the nerves are coming out between the two arteries. I want you to appreciate the two arteries also. Guys, what artery is this? The artery running in front of the brainstem, that is basilar artery, correct? That is a basilar artery. And we all know that basilar artery divides into a terminal branch called as posterior cerebral artery. Now this here is posterior cerebral, and just proximal to posterior cerebral, this is the superior cerebellar artery. Both are branches of basilar. Terminal branch of basilar is posterior cerebral, and then we have superior cerebellar artery, and between these two arteries, can you see third nerve as well as this thin fourth nerve coming out? Look at this thin nerve here, fourth nerve. Third and the fourth nerve, both nerve emerges between the posterior cerebral and superior cerebellar artery. So till now we can see the optic infundibulum, we can see here mammillary body and third nerve. Now this you can see is the area called as posterior perforating substance. And I hope you can make out from this picture that why we call it posterior perforating, because the branches of PCA, look at these branches going from here. The branches of posterior cerebral artery are piercing this gray matter area to reach inside and supply the core structures there. So gray matter area in the interpeduncular fossa perforated by the branches of PCA is posterior perforating substance. I will write this for you, but look here. What about anterior perforating? Now this is anterior perforating here, look at that, that is anterior perforating. Now what blood vessel you see? You can see the major internal carotid artery is present over it. And we know that internal carotid artery gives off, a direct branch of internal carotid artery is anterior cerebral as well as middle cerebral, which is going into the Sylvian sulcus. You can see it here also. This is internal carotid. It gives off anterior cerebral going forward and middle cerebral is going toward the Sylvian sulcus. So that means both anterior cerebral and middle cerebral are present in this region, And that's why both ACA as well as MCA will give the perforating branches entering through this part, and that's what anterior perforating substance is. So anterior perforating substance is a gray matter area perforated by the branches of both ACA and MCA, both anterior cerebral and middle cerebral, whereas posterior perforating substance is the gray matter area perforated by the branches of only PCA. Let me just write that for you as well. So what we said, anterior perforating substance, this here is the gray matter area perforated by the branches of PCA, posterior cerebral artery. Perforated by the branches of PCA. Whereas on the other hand, this anterior perforating substance is the gray matter area which is perforated by the branches of anterior cerebral as well as middle cerebral, both anterior as well as middle cerebral artery. They do ask question on this. So posterior perforating substance, only posterior is there, and anterior where we have both anterior as well as middle cerebral artery branches. Now there's another question here which is asked twice, and that is about the relations of anterior perforating substance. Guys, anterior perforating substance relation. Now two relations are quite clear from this schematic picture only, that medial relation is optic chiasma and posterior relation is optic tract. Now what is going to be the lateral relation? What is there outside? Now strias are there, fine, but relation, I mean, what is there outside? Medial is optic chiasma and posterior is optic tract. Again, this picture will help you understand that those relation. If I take you back here, now look at anterior perforating substance. Medially we have this chiasma, that is optic chiasma. This is the one, and posteriorly we got optic tract. But laterally, now can you see that sulcus in which middle cerebral artery is going? That sulcus over there is the Lyman insulae. Lyman insulae. That is a point from where the lateral sulcus will begin. We have a lateral sulcus on the outer side, but lateral sulcus of the brain starts from the inferior aspect, then it goes like this, and then on the outer aspect it comes and divides into three divisions. We have divides into the three branches. We have a ascending branch and posterior branch and all. We will see that from the superior lateral surface. So overall, this point over there where you see the middle cerebral artery is entering over there, this region is called as a Lyman insulae. And more behind that or posterior to that, we have a part of the cerebrum called as uncus. If you remember, uncus was forming the lateral relation of cavernous sinus, the same uncus. So if the question is precisely about the lateral relation, your best answer is Lyman insulae, and more posterior laterally we have uncus present there. So if I write the relations of anterior perforating substance, so first medial relation was what? That was optic chiasma. Posterior relation is optic tract. And then comes the important one, that is lateral relation. Your best answer here is going to be Lyman insulae. If Lyman insulae is not in the option, you can go with uncus also. But uncus should be your second best choice. Lyman insulae, uncus. Uncus is more posterior laterally present. So this is about the ventral aspect of the brainstem. So what all we discussed on the ventral aspect, we saw how cranial nerves are coming out. That's one important thing, because they do ask a lot of image-based question in which you need to identify the nerve. So they will just simply say, okay, injury to which of the following nerve will lead to the divergent squint. So if first we need to know divergent squint is by which nerve, then we need to identify that nerve on the brainstem also. So the pictorial representation of all these nerves are very important. We talked about interpeduncular fossa, its boundary, its content, and also about the perforating substance, with a special emphasis on the relations of anterior perforating substance. Now it's time to turn the brainstem, guys. Let us turn the brainstem, and this time, as we said, from posterior aspect, we have to remove the cerebellum. And once you remove cerebellum, we said the fourth ventricle will be exposed. What I'm going to do is, I'm going to show you a picture first and then we'll draw it. It will be easy for us. So if I take you to the dorsal aspect of brainstem, this is going to look something like this. Look at this low magnification first. Now this part here is the midbrain. Now don't worry about that part. That is the thalamus. You can see a portion of thalamus can be seen extending backward here. So this is the midbrain part. And how can I say midbrain? I can see 4 colliculus over there. 2 superior colliculus and 2 inferior colliculus. Please don't worry about this. This is pineal gland, which is not the part of discussion as of now. That's a pineal gland, so let's exclude it from here. Apart from that, you can see the 2 superior colliculus. Let me write over there. We have superior colliculus and these are inferior colliculus. And superior and the inferior colliculus together are called as corpora. We call them corpora quadrigemina. 4 gem-like structure, corpora quadrigemina. And if you remember, there was a cistern present behind this and above the cerebellum. We call it superior cistern or quadrigeminal cistern. So that is basically facing these corpora quadrigemina only. And what is also to be understood from here, that cerebellum, even if you remove the cerebellum, the midbrain is not going to get affected, because behind midbrain there is no cerebellum. Cerebellum is present behind the pons and upper medulla. So removing the cerebellum from the brainstem, you're literally distorting the dorsal aspect or posterior aspect of pons and upper medulla oblongata, but not the midbrain. So if the cerebellum is there or not there, this portion is still intact. Just below these 4 colliculus, can you see those nerves coming out? Well, I hope you can easily identify that is the only cranial nerve coming from the dorsal aspect of brainstem, and that is 4th nerve. And I told you in the cranial nerve discussion that the decussation of 4th nerve, it takes place within the midbrain and then they come out. That means this 4th nerve is coming out from the nucleus present on the other side. So the decussation has already taken place within the midbrain only, and then the nerves are emerging out. In some text or some pictures on the Google, they've shown that decussation is outside the brainstem. That is not true. It is inside the brainstem. And then you are looking at this 4th ventricle over there. That is the floor of 4th ventricle. But before we talk about 4th ventricle, you first need to look at the boundaries there. What are the structures forming the boundary of 4th ventricle? Well, how will you remove? When I said remove the cerebellum, means how you need to cut the cerebellum. You have to cut the peduncles. The only way cerebellum is connected to brainstem is through cerebellar peduncles, superior, middle, inferior. Once you cut the cerebellar peduncle, then obviously cerebellum can be detached. If you look carefully, look at that white matter bundle where I'm pointing at right now. This white matter bundle is coming from above, that is from midbrain. So this has to be the superior cerebellar peduncle. The one which is coming from below here, look at this one. They've shown you the different shade also. That is inferior cerebellar peduncle. And the one which is more outside, shown in a lighter shade, that is a middle cerebellar peduncle. Cerebellar this time, guys. This is superior cerebellar peduncle. This is inferior, and this one is a middle cerebellar peduncle. And what is very, very interesting to note here, that superior and the inferior cerebellar peduncle, they converge in such a way that they both fuse, and that leaves the middle cerebellar peduncle outside. So when you talk about the boundary of the 4th ventricle, we are not going to count the middle peduncle. When you're looking at the boundary of 4th ventricle, we are not going to count the middle peduncle because that is outside now. So we got a superior peduncle coming from above, inferior cerebellar peduncle from below, fusing. And is there anything else forming the boundary? Yes, there is. Guys, if you look at this portion of the medulla oblongata, so it is a continuation from the spinal cord. Now I want you to think about it. If you think about the spinal cord, what is there at the dorsal aspect of spinal cord? At the dorsal aspect of spinal cord, we have a dorsal column tract having fasciculus gracilis and fasciculus cuneatus. So that means this here, look at my finger here. This is fasciculus gracilis here, and this will be the fasciculus cuneatus. And we know that the nuclei for the fasciculus gracilis and cuneatus are in the medulla oblongata, and they're present in these elevations only. And that's why they're elevated, because we have a nuclei present deep to them. So we have a nucleus gracilis and nucleus cuneatus present inside. And that's why these tubercles are called as a gracile tubercle and cuneate tubercle. That is the point where the first order neuron of dorsal column tract are ending here. That is a gracile tubercle and cuneate tubercle. So overall, the boundaries of the 4th ventricle, when I talk about, so it has to be the inferior cerebellar peduncle, superior cerebellar peduncle and inferior cerebellar peduncle. Middle stays out, so let's not count it. And in the lower part, we also have a contribution from the gracile and cuneate tubercle. I'm going to redraw everything, in a schematic way. First, I wanted to understand it here. Then inside the fourth ventricle, in the floor of fourth ventricle, what you will see? Now in the floor of fourth ventricle, guys, this sulcus here is called as the sulcus limitans. The same sulcus limitans which we said earlier, dividing the neural tube in two parts. So that sulcus over there is called as sulcus limitans. So when the neural tube opens, we said the alar plate is the one which goes toward the lateral side and basal plate is toward the medial side. That means the one toward the lateral side, one which is lateral to the sulcus limitans, this is going to be the alar plate. And I hope you remember the alar plate was sensory. So the nuclei which will be present deep to this alar plate will be some sensory nuclei. Whatever it is, it will be sensory nuclei. But medial to the sulcus limitans, all these elevations that you see are because of those nuclei which are motor in nature. We have a facial colliculus, we have a the triangle where we have a hypoglossal nerve and vagus nerve nucleus situated. So the motor nerves are the one which are or nuclei situated medial to the sulcus limitans. We have some white matter bundle also to be seen. I'll come to that. Let's first discuss till this part. So looking at the dorsal aspect, dorsal aspect of brainstem, and what else we'll achieve by looking at the dorsal aspect of brainstem, we also will be looking at the floor of fourth ventricle. We'll be looking at the floor of the fourth ventricle, which because of its shape is also called as a rhomboid fossa. Because of its shape is also called as a rhomboid fossa. Rhomboid fossa. So here we go. These are the two colliculus, the two superior colliculus and the two inferior colliculus. So starting from the midbrain part, we got superior colliculus and inferior colliculus. And as we already mentioned, these four colliculus together are called as the corpora quadrigemina. Corpora quadrigemina. This here is the floor. So we got a superior cerebellar peduncle converging downward. This is inferior cerebellar peduncle. There we go. This is inferior going above and then meeting with the middle cerebellar peduncle, which is more laterally placed here. Superior, inferior, and that is middle cerebellar peduncle. Let me label this. This is a superior cerebellar peduncle. Let me just draw this arrow that is converging toward the pons, that is coming downward. Here we have ICP, that is inferior cerebellar peduncle, which is going upward, and they're all fusing along with middle cerebellar peduncle and entering into the cerebellum, which is removed from this picture. And then we also said close to the midline, you will see the gracile tubercle and cuneate tubercle will also be contributing to the boundary. The gracile and cuneate tubercle. The tubercle which are because of the nucleus present deep to them. The nucleus gracilis and nucleus cuneatus is present deep to them. So that's why we call them gracile and cuneate tubercles. So that's the boundary thing. As we said, in the floor of fourth ventricle, we will see the sulcus limitans. Now, let's say this is sulcus limitans. First it converges. Just draw it in this way only. So that I can show the nuclei. So this is sulcus limitans, the one which was dividing the neural tube into the dorsal part called as the alar plate and the ventral part which was basal plate. And therefore everything that you see medial to sulcus limitans is made up of basal plate. We got to have motor nuclei in this region here. We will be having motor nuclei present deep to this part. And sensory nuclei will be present lateral to the sulcus limitans here. The most important elevation, and on which one question is asked like multiple time, that is the elevation called as the facial colliculus. Well, in the region of pons only, we have used this term earlier also. This is the facial colliculus. Facial colliculus. We'll talk about facial colliculus a little more in a while. Facial colliculus. Below facial colliculus, this triangle here, this triangle, if I mark this portion, we have a nuclei present deep to this. That is a hypoglossal nucleus present deep to this. So we call it hypoglossal triangle. We got a hypoglossal nucleus present here. So we call it hypoglossal triangle or trigone, some author says. Triangle or trigone. And further below, we have a dorsal nucleus of vagus present here. That's why it is called as a vagal triangle. So look at these three elevations. I'm trying to use the same color, that is facial colliculus, the hypoglossal triangle and vagal triangle. And we said what is common between them? They are all developing in the basal plate. So you got to have a motor nuclei present deep to them. The one mistake which people do in this part is in the facial colliculus. The name is facial colliculus because facial nerve is winding around sixth nucleus. So if I have to ask you this question, that what nucleus is present deep to this elevation? What is the nucleus deep to the elevation? So it's not the facial nucleus, it is the sixth nucleus. Facial nerve is winding around it, and that's why the name is facial colliculus. So facial colliculus is having sixth nucleus deep to it and not seventh, sixth nucleus. For rest of the two, it is fine. We have a hypoglossal nucleus there. I'm writing nucleus. And the vagal nucleus is there. What about on the lateral side? On the lateral side, lateral to sulcus limitans, that elevation is called as a vestibular triangle. That is a vestibular triangle. And the nucleus present deep to the vestibular triangle is obviously the eighth nerve nucleus. So eighth nucleus, simply let me say. Vestibular nucleus is the eighth nucleus. So guys, first and the most important thing to note, if the question says what are the nuclei present in the floor of fourth ventricle or projected in the floor of fourth ventricle, don't write seventh. It is 6, 8, 10 and 12. If I go in a sequence, 6, 8, 10 and 12. So make sure to write it nucleus or nuclei, not saying nerve, nuclei present in the floor of fourth ventricle. Nuclei present in the floor of fourth ventricle involves 6, 8, 10 and 12. 6, 8, 10 and 12. 6, 8, 10 and 12. But there is something very interesting about the facial colliculus. We said facial nerve is winding around this sixth nucleus and comes out. Now, what is the need for that? Why facial nerve has to wind around any nucleus to come out when the facial nerve simply has to come out from the ventral aspect of brainstem? What I'm trying to say, if I tell you a little more about this facial colliculus, guys, if let's say this is a section of the pons, we'll be discussing about the section in a while. It's a transverse section. It's a transverse section of the pons. And here we have sixth nucleus. And somewhere inside we got a seventh nucleus. So what I'm saying is that seventh nerve will wind around like this and then it emerges out. That's how the seventh nerve is coming out, by winding around. And we also call it the internal genu of the facial nerve. You know that. That is the internal genu of the facial nerve. Well, the bent is called as internal genu. Bent is called as internal genu. And this elevation which is produced on the surface here, this one, this is called as the facial colliculus because of the facial nerve. So we call it facial colliculus. First, let's understand that what is the need for all this. Why facial nerve has to wind around the sixth nucleus and comes out when the facial nerve can simply come out like this only. Well, if you think about all the cranial nerve nuclei, once again that topic becomes very important. If you think of all cranial nerve nuclei, now the main motor nucleus of face is facial nucleus. We know that facial nucleus is supplying majority of the muscles, or in fact all the muscles of facial expression. And the main sensory nucleus of the face is trigeminal nuclei. Now, can you think of that where those nuclei were located? If you think of facial nucleus, which was present in the second column, SVE, pharyngeal arch column, the very second column was for the facial nucleus, and the second last column was for the trigeminal nuclei, the GSA, general somatic afferent column. SVE column and general somatic afferent column are far apart from each other. And imagine if your facial sensory and motor nucleus are situated very far from each other in the brainstem, then the speed of the reflexes will be very, very slow. You need to have a quick reflexes. And how can you have quick reflexes if the nuclei are situated close to it? Now, out of the trigeminal nuclei and facial nuclei, you can imagine it like this: the trigeminal nucleus is huge. It's a big trigeminal nucleus we have, but facial nucleus is in the pons. It is a smaller nucleus. So developmentally, what happens? This facial nucleus actually migrates towards the trigeminal nucleus, and during this migration, it actually winds around the abducens nucleus. That's why the internal genu is formed. This phenomena, where a sensory nucleus and the motor nucleus, they come close to each other so that the reflexes becomes a little fast, is called as neurobiotaxis. That is called as a neurobiotaxis. So I can say this internal genu is a resultant of a phenomena called as a neurobiotaxis. Neurobiotaxis. What is neurobiotaxis in this case here? What is the neurobiotaxis in this case? That motor facial nucleus migrates towards which one? Towards sensory trigeminal nuclei. Motor facial nucleus migrates toward the sensory trigeminal nuclei for faster reflexes. That's what you call as the neurobiotaxis. Now, how examiner tried to trick us in this question is, I've seen this question asked in AIMS twice in a row, and both the time the question was entirely different though. They gave this a picture of the floor of fourth ventricle, both the time same picture only, and the arrow was pointed at facial colliculus. Now let me just bring it back here. Now this is facial colliculus you have here. Let's say if I put an arrow on the facial colliculus, and the first time the question was pretty simple. The question was that what is the nucleus present deep to the following elevation. So although we call it facial colliculus, but the nucleus present deep to it is a sixth nucleus, abducens nucleus, and most of the people who read about the fourth ventricle, they got it right, no problem. Very next year, what they did, they gave the same picture of the floor of fourth ventricle. They again put the arrow on the facial colliculus, but this time the language of question was completely different. The question this time was injury to the structure producing following elevation. Look at this one, and facial colliculus. Injury to the structure producing facial colliculus or producing this elevation will lead to the paralysis of which muscle? Now, we said what nucleus is present deep to it is abducens nucleus. So if you think about abducens nucleus, you will mark the answer as lateral rectus. But that's not the thing. We know that abducens nucleus is surrounded by the facial nerve. It winds, what facial nerve is winding around this abducens nucleus. So every time you have injury to the facial colliculus, the first thing to go is facial nerve only. Facial nerve is the one which is winding around it. So when you say injury to facial colliculus, the first structure to be injured probably here is the facial nerve. Lower motor neuron of facial nerve will be there, and we know that if there is a lower motor neuron lesion of facial nerve, it leads to ipsilateral facial paralysis. So let me write this point as well here, that injury to, if the question says injury to structure producing facial colliculus, injury to the structure producing facial colliculus means lower motor neuron lesion of facial nerve. Lower motor neuron lesion of facial nerve, and that as we already know, will lead to the ipsilateral facial paralysis. Don't go with lateral rectus as an answer. They purposefully gave lateral rectus in the option so that people marked it. If the question would have said injury to the nucleus present deep to the following elevation, then you will say, okay, abducent nucleus will go, because they have asked the question based on the nucleus. But if the question simply says injury to the structure producing facial colliculus, the facial colliculus is mainly because of facial nerve which winds around the abducent nucleus. So answer has to be the facial nerve injury in that case. If I take you back to this picture, there are few more things to look here. Like the nerve that we said coming from the dorsal aspect of brainstem, and that was the fourth nerve. The trochlear nerve will be seen emerging from the dorsal aspect of brainstem just below inferior colliculus. Fourth nerve nucleus was at the level of inferior colliculus only. So the nerve is seen coming out below the inferior colliculus after decussation and winds around the peduncles. It is also to be noted that this inferior angle, when you look at this very much inferior angle of the fourth ventricle, this is the site where the blood-brain barrier is not present. And what we said, the area devoid of blood-brain barrier, which are called as circumventricular organ, and one of the circumventricular organ is here only. That is what? Area postrema. The vomiting center, the area postrema. Area postrema, you can note that it is also called as the vomiting center of the brain. Area postrema is the vomiting center of the brain. One more term if you want to add here, if you look at the inferior angle, guys, if you look at the entire inferior angle of the fourth ventricle, the shape of the inferior angle of fourth ventricle looks like a nib of an ink pen. Can you see that? It looks like a nib of an ink pen in this lower part here. And that's why the inferior angle of fourth ventricle is also regarded as calamus scriptorius. Calamus is for the pen, calamus word is for the pen, scriptorius, the one which is used to write the script. So inferior angle of the fourth ventricle is also known as the calamus. Calamus is for the pen, scriptorius. Calamus scriptorius. So this is about the dorsal aspect of the brainstem, where we saw some part of the midbrain as superior and the inferior colliculus and the fourth nerve coming out. We saw an important part of the medulla also, the gracile and the cuneate tubercle, and the main thing that we saw is the floor of fourth ventricle. Now, if I just talk about fourth ventricle, just to summarize at one place, if we just write down the points regarding the fourth ventricle, so guys, first of all, starting with the boundaries, what structures are forming the boundaries of the fourth ventricle? It was a superior cerebellar peduncle, it was inferior cerebellar peduncle, it was gracile tubercle, and also cuneate tubercle. Gracile and cuneate tubercle. Those were the boundaries. Floor, well, floor we already discussed in detail, that is rhomboid fossa only. Whatever we just discussed is all about the floor only. So rhomboid fossa is the floor of fourth ventricle. Now, what about roof? Now, this is important, guys. What about the roof of the fourth ventricle? Now, simply we can say roof is the cerebellum only. We remove the cerebellum, then only we can see the floor part. Yes, directly you can say cerebellum, but what part of cerebellum, or is there any special extension that we have covering the roof of the fourth ventricle? And that also we'll understand with this diagram. Here we got the pons, let's say anterior, there is pons and medulla oblongata. And this is how the fourth ventricle was, that's the fourth ventricle. And here we got cerebellum. That is cerebellum, right? Now look at this. This is forming the roof in the upper part, this portion. And then below this angle, this is forming the lower part of the roof. This is fourth ventricle, and those are the extensions of the cerebellum which are forming the roof. This is referred as superior medullary velum. We call it superior medullary velum. I'll tell you what is that. Superior medullary velum, and this here is the inferior medullary velum. Guys, out of superior and the inferior medullary velum, the superior medullary velum is a misnomer. See, calling inferior medullary velum makes sense because it is behind the medulla oblongata, more or less. So that is fine. But superior medullary velum is present behind the pons, so that is not medullary. But we still just, it's a misnomer only, but we call them medullary velum. Superior medullary velum is a nervous structure. It is made up of white matter only. It is made up of white matter. So it is basically we have axons there. So it is a white matter. It's a nervous structure. But inferior medullary velum is having an extension of pia mater present. So it is a non-nervous structure. It is a non-nervous structure. Superior medullary velum is a nervous structure and inferior medullary velum is a non-nervous structure. And what else you can appreciate, that between the superior and the inferior medullary velum, you can see the fourth ventricle is extending backward toward the cerebellum, toward the core of the cerebellum, and that is called as the posterior recess of fourth ventricle. This is the posterior recess of fourth ventricle. So this is the fourth ventricle here. So when you see the roof, there is an extension of the fourth ventricle backward, and that you call as a posterior recess of the fourth ventricle. So this is about the dorsal and the ventral aspect of brainstem. With that, we're done with the how cranial nerves are coming out from the brainstem. We talked about interpeduncular fossa. We saw the perforating substances. We also talked about the dorsal aspect where we saw the rhomboid fossa. And again, only one cranial nerve coming from the dorsal aspect. And other features of the what elevations we see in the floor of fourth ventricle. That is an important question, especially the facial colliculus part. So in the next section, we will be talking about some other major tracts inside the brainstem, like the trigeminal pathway and the auditory pathway, knowing about the lemniscus, so that we can talk about the syndromes of the brainstem.